Good morning, family, and welcome back to another Channels of Hope HIV/AIDS session. Today, we're going to be talking about ARVs, or antiretroviral therapy, which is the treatment or the medication that persons who are HIV positive take. So, what are ARVs? ARVs stand for antiretroviral therapy. And these are medications that stop HIV from making copies of itself and destroying your CD4 cells. When antiretroviral therapy is working, your immune system has time to recover and replenish its stock of CD4 cells. Now, currently, there are more than 30 HIV medications available. For most persons recently diagnosed with HIV, all they have to do is take one pill per day. Your doctor, however, will choose the best medication for you. For persons diagnosed with having HIV, you should begin taking ARVs as soon as possible. This will help to prevent the progression of HIV and also to reduce the spread of HIV to others. So, how do you know if your ARVs or your HIV medication is working? Your doctor will do 2 tests to determine the progress of the medication. So these tests are the viral load test and the CD4 count or T helper count test. These tests will help you understand how HIV is being controlled by the medication that you are taking. Now, let's look at the HIV viral load test. HIV viral load measures the amount of HIV in the blood, and the goal of the treatment is to make the HIV viral load as low as possible. This is also called viral suppression. HIV currently has no cure, and so your body can never get rid of the HIV virus completely. But viral suppression does mean that the amount of virus in the blood can be so low that it does not do much harm. So viral suppression means that the medication that you're taking is working and your CD4 cells or T helper cells are protected. Once treatment begins, it could take about 3 to 6 months for you to achieve viral suppression. When your viral load is suppressed, there's a very low risk of passing HIV to a sexual partner. Now let's look at the CD4 count or T helper cells test. Your doctor will also monitor your CD4 count or your T helper cells. This is the medical term for the number of T helper cells in your blood. It's important for monitoring how well your immune system is functioning, and the higher your CD4 count is, the better it is for you. As the viral load decreases, the CD4 cells increase. If HIV goes untreated, the CD4 cells will progressively decrease. And if your CD4 count or your CD4 cells drop below 200, then HIV has progressed to AIDS or acquired immunodeficiency syndrome. The presence of AIDS indicates that your immune system is very weak and that you're at a very high risk of serious infections due to other viruses, bacteria, or fungi. Now, can your body be immune to the ARVs you're taking, or can your body resist the treatment? Yes. When HIV is making copies of itself, sometimes it can make mistakes, and these mistakes are called mutations, right? And mutations can develop that mess with the ability of the ARVs to actually do their jobs. And this is what we call drug resistance. The risk, however, of mutation or any mutations developing in the body while someone is taking their ARVs medication is very low, extremely low. If you take your medication every day and your viral load remains low, then you are safe. However, starting and stopping your HIV medication can lead to drug resistance. Because there is no cure for HIV, HIV stays with you forever. So you must take your HIV medication every day on time for the rest of your life until a cure is found. The good news is there are minimal side effects that occur from taking your HIV medication. So you don't have to worry about those side effects. Great. So if you have any questions as it relates to HIV, as it relates to AIDS, as it relates to ARVs, feel free to leave them. If you have any comments as well, feel free to leave those comments, and we'll be more than happy to answer them for you. So enjoy the rest of your day until the next video.